End-of-life issues. So why are we discussing end-of-life issues? Well, with healthcare constantly advancing, questions about the quality of life and death have increased. People are concerned about the expenses of prolonging life, and if prolonging the dying process is just prolonging suffering for patients. We must remember that towards the end of a patient's life, they still have the right to receive the best care they want from the nurses in the hospital and the nurses that are provided at home. So what are some main end-of-life topics? Well, for one is assisted suicide. This is the suicide of a patient suffering from an incurable disease by taking the drugs provided by their doctor. Another is active euthanasia. This is the acceleration of a good death by the use of drugs also provided by the doctor. Third, we have patient self-determination. The Patient Self-Determination Act, or the PSDA, states that all people should make choices and decisions now about the extent of medical care they want or refuse should they become unable to make those decisions later in life due to the illness. Fourth, we have do not resuscitate decisions. These choices state if a patient would like to receive CPR or other life-saving interventions if their heart stops. And pain management in dying patients. This is providing constant pain medications to a patient at the end of their life. So why is this important? Well, more and more people are beginning to live longer because of medicines and hospital stays. Nurses will care for more of those patients in their end of life. So we as nurses must respect the patient's decisions regarding their life. And a nurse must recognize their own values and attitudes and expectations about death to provide the ethical care in the hospital. So how is end-of-life issues or care related to CUSIN? Well, it's related to the patient-centered care. We as nurses must put ourselves in the patient's shoes. This can be difficult because we don't always agree with the decisions a patient makes about their end-of-life care. When we provide that care, we assess for the presence and extent of the pain and suffering and levels of physical and emotional comfort. We can provide that of physical and emotional comfort. How is end-of-life care related to the BSN essentials? Well, it's related to the second essential, basic organizational and systems leadership for quality care and patient safety. We provide quality care when we follow the patient's wants in their end of life. We must put our views second to theirs and give them the best care we can. Also, nurses must recognize that it is a complex system that involves individuals, families, groups, communities, populations, and other members of the healthcare team. All these can affect how a patient acts or wants their end of life taken. The class question: do you have any end of life plan? And what measures do you want taken to keep you alive?